If you're waking up every morning with your tongue stuck to the roof of your mouth, your lips dry, your throat scratchy, and that desperate need to grab water before you can even speak, I need you to stop brushing this off as something small. I'm Dr. Aliza Wright, and today I want to show you what that pattern can look like. Because if you take losartan, amlodipine, lisinopril, or valsartan, and you've also noticed ankle swelling, a cough at night, dizziness when you stand up, strange fatigue, headaches, a pounding heartbeat, or that washed out feeling you can't explain, your body may be trying to warn you before something gets worse. The dry mouth is often the symptom people notice first because it shows up in silence, in the dark, before the distractions of the day begin. But it is rarely the only clue. It's just the clue that finally gets your attention, and once you understand what it can mean, you will never ignore it the same way again. Before we begin, please subscribe to this channel for senior health guidance, practical warnings, and simple explanations that protect you. Let me tell you about Carol, because her story begins exactly where so many of these stories begin. Carol was 72, disciplined, careful, proud of how seriously she took her blood pressure. She kept her pills beside her bed, took them on time, followed instructions, and never missed an appointment. But she started waking up at 3 a.m. with a mouth so dry she felt like she had cotton packed inside it. She thought, maybe the heater was too strong. Then she thought perhaps she was just sleeping with her mouth open. Then came the second clue, a cough. Not a wet chest cold cough, not a fever cough, a dry, irritating little tickle that kept catching her in the middle of the night. And by the time she got out of bed in the morning, she felt slightly lightheaded too. Carol blamed the season, her daughter blamed allergies, her neighbor blamed dust. But the real issue was sitting right there in her pill organizer. She had started lisinopril 6 weeks earlier. And this is where I need you to listen carefully, because lisinopril belongs to a group of medications called ACE inhibitors. And one of the best known side effects in that group is a stubborn, dry cough. Not everyone gets it, but when it happens, it can creep in so gradually that you barely notice the pattern at first. You clear your throat more. You keep water beside the bed. You wake up irritated. You breathe through your mouth more often because your throat feels strange. And once mouth breathing becomes part of your night, dry mouth can become almost inevitable. The mouth is dry, yes, but the medication story is often hiding behind it. That cough matters more than people realize. It isn't just annoying. It changes the entire quality of your sleep. It makes you wake lightly instead of resting deeply. It can make you start sleeping with your mouth open. It can leave your throat raw by morning and your saliva thick and sticky. And then what happens next is what I see over and over again. People don't connect the dots. They think, I need more lozenges, more water, a better pillow, a humidifier, maybe a different toothpaste. But they do not realize the medication may be the spark that started the whole chain reaction. So the cough continues, the dry mouth worsens, the sleep gets poorer, the daytime energy drops, and the person begins living in this low-grade state of irritation and fatigue without ever understanding why. Now here's the part your body may be warning you about even more strongly. Lisinopril does not only cause a cough in some people, it can also make some people feel dizzy, especially when they stand up quickly. That matters because dry mouth and dizziness together often point toward a deeper issue with fluid balance, blood pressure dropping too low, or the body struggling to adapt to a medication change. If you wake up dry, stand up, and feel the room tilt for a second, do not call that normal. Do not say, I'm just getting older. That tiny morning spin can be your body telling you the pressure is falling too far, the medication dose needs review, or your hydration is off in a way that deserves attention. And there is something else about lisinopril that people almost never take seriously enough until it becomes an emergency. Swelling of the lips, tongue, face, or throat. This is not the same as a little dry mouth or a harmless cough. This is a red flag reaction. If someone on lisinopril suddenly notices lip swelling, tongue thickness, throat tightness, or trouble breathing, that is not a wait until Monday symptom. That is urgent. The reason I'm telling you this in the same conversation as dry mouth is simple. Sometimes people describe the very beginning of throat swelling as, my mouth felt weird, my tongue felt thick, my throat felt dry, something felt off. And that vague feeling can be the earliest warning before it becomes obvious. So never ignore a strange mouth or throat sensation if it arrives with swelling or breathing trouble, especially on an ACE inhibitor. Now let's move to amlodipine, because this medication tells a different story. And the story usually does not begin with cough. It begins with the legs. Elaine was 69, recently started on amlodipine, and at first she felt fine. A little flushed some afternoons, maybe a mild headache, nothing dramatic. Then she noticed her socks were leaving deeper marks around her ankles. Then her shoes felt tighter by evening. Then she looked down one night and saw that both ankles seemed puffier than they had a month earlier. Around the same time, she began waking up thirsty, uncomfortably thirsty, because she had started limiting her drinking in the evening. She thought the swelling meant she was holding too much water, so she drank less. And without realizing it, she made her dry mouth worse, while the leg swelling kept getting worse anyway. This is one of the most misunderstood side effects of amlodipine. People assume swelling means the body is simply overloaded with fluid in the usual sense. So they cut back on drinking, or they panic and think their kidneys are failing, or they just blame salt. But amlodipine can cause swelling in the ankles and lower legs because it changes how blood moves through small blood vessels. The arteries relax strongly, but the return side of the circulation does not always relax in the same way, so fluid can leak into the tissues. That is why the legs and ankles start looking puffy. And because it happens gradually, people normalize it. They say, well, I was on my feet too long. Or, maybe that's just age. No, sometimes it is the medication speaking very clearly. What makes this particularly sneaky is that people often try to solve the wrong problem. They see swelling, so they stop drinking enough water. Then they wake up with dry mouth. Then they feel tired. Then they stand up and feel a little strange. Now the picture looks confusing, but the body is actually describing one coherent story. Amlodipine may be contributing to the swelling, and your reaction to the swelling may be worsening the dryness and fatigue. Add poor sleep, maybe a little nighttime mouth breathing, maybe a warm room, and suddenly you have a symptom cluster that feels mysterious when it really isn't. And the longer people wait, the more they adapt to discomfort that should have triggered a medication review much sooner. That is how minor side effects quietly steal quality of life a month after month. Amlodipine can also bring along other clues that people dismiss far too easily. Headaches that seem to show up for no reason. Flushing, where the face feels warm and red. A pounding heartbeat that makes you suddenly aware of your pulse. Dizziness, fatigue. Occasionally that heavy, draggy feeling in the afternoon, where everything in your body seems just a little slower than usual. None of these automatically mean the medication is wrong for you. Many people do very well on amlodipine, but if the drug is helping your blood pressure while making the rest of your day miserable, that is not a detail to keep to yourself. It is a clinical fact your prescriber needs. Because sometimes the answer is a dose adjustment. Sometimes it is timing. Sometimes it is combination therapy. And sometimes it means you simply need a different medication entirely. Now let me tell you about Walter, because his story brings us to losartan. Walter was 75 and thought he was doing everything right. He took his losartan in the morning, tried to walk every day, and because his doctor had told him to stay hydrated, he made a point of drinking more fluids. But then he got a stomach bug. Nothing dramatic, just a couple of days of loose stools and a poor appetite. By the third morning, he woke up with an extremely dry mouth, stood up from bed, and nearly fell into the dresser. He described it to me later as if his body had no blood in it for a second. That sounds dramatic, but patients use language like that because dizziness can feel terrifying. And in Walter's case, the dry mouth was the clue that the body had already been losing too much fluid. This is one of the major issues with losartan and also with valsartan. These drugs can be very helpful, but if a person gets dehydrated from vomiting, diarrhea, hot weather, sweating, poor intake, or another medication in the mix, the blood pressure can drop too far. Suddenly, the morning dry mouth is not just a mouth problem. It is part of a dehydration story. Your saliva is down, your throat feels dry, your head feels light, your body feels weak, and when you stand, you realize something is wrong. People miss this because they imagine dehydration must mean extreme thirst in the middle of the day. Not always. Sometimes the earliest sign is waking up dry and feeling vaguely off before breakfast, before coffee, before the day starts. And if you brush past it, the dizziness can be what finally forces you to pay attention. Losartan can also bring fatigue that people describe in subtle ways. They say they feel less sharp. They say mornings feel harder. They say there is nothing dramatic, just a strange heaviness in the body. That matters, because when dry mouth, fatigue, and dizziness travel together, the question is no longer whether you need a bigger water bottle. The question is whether the medication, the dose, your recent hydration status, or your kidney function needs a closer look. And I want to be very precise here. I am not telling you losartan is a bad drug. It helps many people and protects many hearts and kidneys. I am telling you that when your body starts sending repeated signals, especially signals that cluster together, you should not reduce them to random annoyances. Symptoms are information, and older adults are too often taught to ignore their own information. There is another warning with losartan that deserves more attention than it gets. If you faint, nearly faint, or keep feeling like you might black out when you rise, that is not the time to give it a few more weeks on your own. And if you become sick with continued vomiting or diarrhea while taking it, that matters, because the medicine that normally helps can suddenly become too much for a dehydrated system. The same goes for heavy sweating in hot weather, long outdoor activity, or a stretch of poor eating and drinking. If your mouth is dry, your urine is darker, your energy is low, and your balance feels uncertain, your body may be telling you the equation has changed. The pill may be the same, but the body receiving it is not. And that difference is where many preventable falls begin. Now let's talk about valsartan, because people often place losartan and valsartan in the same mental box and assume they feel exactly the same in every body. They do not. Shirley was 71 and started valsartan after struggling with a different medication. She was relieved at first because she did not develop the cough she had feared. But after a while, she began waking up with a dry mouth and a dull headache that sat right behind her eyes. Some mornings she felt a little nauseated. Some days her muscles felt unusually tired. Nothing severe enough to send her to the hospital, but enough that she no longer felt like herself. And because she had no dramatic single symptom, she never brought the whole picture to her doctor. She mentioned the headache once, the dizziness another time, the dry mouth to her dentist, the fatigue to her daughter, and nobody heard the full story together. Valsartan can cause dizziness. It can come with headaches. Some people get nausea, vomiting, or diarrhea. Some report muscle or joint discomfort, unusual weakness, or that strange drained feeling that makes even ordinary tasks seem heavier than they should. And when digestive upset enters the picture, the dry mouth can intensify quickly because saliva production and fluid balance are both affected by dehydration. The person wakes dry, drinks more, feels a little better, and assumes the problem is solved, but the pattern repeats. That repetition is what matters. A random dry mouth once in a while can come from many things. A repeated early morning dry mouth paired with dizziness, weakness, nausea, or poor balance while taking valsartan is not something I want you shrugging off as coincidence. Because sometimes the body repeats a warning precisely so you will finally listen before the fall or faint comes. There is also a laboratory side of this conversation that viewers need to understand. Some blood pressure medicines, especially ACE inhibitors and ARBs, can affect kidney function and potassium levels. You cannot see your potassium with your eyes. You cannot feel your creatinine rising in a neat, obvious way. But the body may give hints: unusual weakness, strange fatigue, dizziness, feeling not right, changes after illness, or swelling in areas that do not make sense. That is why a symptom journal matters so much. If you wake with dry mouth every day for 2 weeks, write it down. If you also notice ankle swelling, write that down. If the cough starts after a medication change, write down the date. If dizziness hits only when you stand from bed, write that too. Because in the office, memory is unreliable, but patterns on paper tell the truth. And this is the part almost nobody explains clearly enough. Dry mouth is not harmless just because it sounds harmless. Saliva protects your teeth. It helps you chew, swallow, speak, and keep harmful bacteria and fungus under control. When your mouth stays dry, cavities become more likely. Gum problems become more likely. Mouth sores, bad breath, burning sensations, trouble swallowing, and oral infections become more likely too. So when people say it's only dry mouth, I stop them right there. No. A persistently dry mouth is not a cosmetic issue. It is a biological change with consequences. And in older adults especially, those consequences can snowball. Eating gets harder, sleep gets worse, speech feels uncomfortable, thirst wakes you at night, then fatigue builds, then balance worsens, then the whole body begins paying for a symptom that started in the mouth, but never really belonged only to the mouth. I want to pause here and say something important. Not every dry mouth is caused by blood pressure medication. That would be too simplistic and it would not be honest. Mouth breathing can do it. Nasal congestion can do it. Alcohol can do it. Too much caffeine can do it. Stress can do it. Diabetes can do it. Antihistamines and decongestants can do it. Sleep apnea can do it. A warm bedroom can worsen it. Aging itself is not considered the cause, but older adults are more likely to have the conditions and medications that create the problem. So the right way to think about this is not, I woke dry, therefore my blood pressure pill is bad. The right question is, what else is happening with that dry mouth, and when did the pattern begin? This is why combinations of symptoms matter so much. Dry mouth plus a nagging nighttime cough points you toward one kind of medication conversation, especially if lisinopril is involved. Dry mouth plus ankle or leg swelling points you toward another, especially if amlodipine is in the picture. Dry mouth plus dizziness on standing, especially after diarrhea, vomiting, or hot weather, pushes me to think very seriously about dehydration, blood pressure dropping too low, and whether losartan or valsartan needs review in the context of your whole health. Dry mouth plus pounding heart, flushing, and swollen ankles makes amlodipine harder to ignore. Dry mouth plus lip or tongue swelling is an emergency conversation, not a future appointment conversation. The body is very rarely completely silent. It whispers first. Dry mouth is one of those whispers. And the tragedy is that most people only learn to listen after the whisper becomes something louder, scarier, and harder to reverse. Let me tell you about Frank, because his case looked ordinary until we put the symptoms in the right order. Frank was 78. He had high blood pressure, mild kidney disease, and he took more than one medication. He started waking with dry mouth. Then came a cough he noticed mostly at night. Then he became afraid to drink much water in the evening because he was tired of getting up to urinate. A month later, he was dizzy in the mornings, exhausted during the day, and irritable because he hadn't slept well in weeks. He thought he was just in a bad season of life. But when we laid the timeline out, the story became obvious. Medication change, then nighttime cough, then mouth breathing, then dry mouth, then poor sleep, then morning dizziness. Each symptom fed the next one. Nothing about it was random. It was a chain reaction, and once we saw the chain, we knew exactly where to intervene. That is what I want for you from this video. Not panic, clarity. Because panic makes people do dangerous things. They stop medications abruptly. They take someone else's advice from the internet. They cut tablets in half without guidance. They overload on salt to fight dizziness. They stop drinking water because their ankles are swollen. And each one of those choices can make the situation worse. What I want is for you to recognize when a symptom belongs in a bigger pattern, and when that pattern deserves a careful call to the prescribing clinician. If dry mouth is new, persistent, and joined by other warning signs, it has already earned your attention. The body usually does not keep repeating the same message for no reason. It repeats the message because the first few attempts were ignored. And if you listen early, you can often solve the problem before it steals months of comfort and confidence. So what should you actually do if this sounds like you? First, do not stop losartan, amlodipine, lisinopril, or valsartan on your own. I need to say that plainly. These medications can be important, and stopping them suddenly without a plan can create serious problems. Second, start observing with precision. Tomorrow morning, before you tell yourself a story about what the symptom means, gather facts. Is the mouth dry every morning or only sometimes? Is the throat dry too? Are you coughing at night? Do your ankles look different by evening? Are your socks leaving marks? Do you feel dizzy when you stand? Did you recently have vomiting, diarrhea, poor appetite, or hot weather fluid loss? Did the symptoms start soon after a new prescription or a dose increase? That is not overthinking. That is good medicine, because symptoms without timing are vague, but symptoms with timing become evidence, and evidence changes treatment. Third, if you are on amlodipine, look carefully at your feet and ankles at the end of the day and again the next morning. Compare both sides. Think about your shoes. Think about whether rings feel tighter too. Ask yourself whether you've been reducing your fluids because you are worried about swelling. Many people do this without realizing it. They get trapped in a cycle where the swelling pushes them to drink less, and the lower intake worsens dry mouth, headaches, fatigue, and dizziness. If that is happening, do not just keep improvising. Bring it up. Tell your doctor exactly what you are seeing. My ankles swell by evening. I wake up dry. I feel tired. That sentence is more useful than people think. It gives the clinician a pattern to work with, and sometimes a better solution is surprisingly close once the right picture is visible. Fourth, if you are on lisinopril and there is a cough involved, pay attention to its character. Is it dry? Is it worse at night? Does it make you reach for water? Does it wake you from sleep? Do you find yourself clearing your throat over and over? That kind of cough should not be dismissed forever as just one of those things. There may be a reason to consider a medication review, especially if the cough is damaging sleep and leading to persistent morning dry mouth. And again, do not self-diagnose your way into stopping the drug. Just report the facts clearly. Since starting this medicine, I have a dry nighttime cough and I wake with dry mouth. That is a medically meaningful statement. It may lead to nothing more than monitoring, or it may lead to a switch that changes your life. But if you never say it, the suffering stays invisible. And invisible suffering is the kind most likely to be ignored. Fifth, if you are on losartan or valsartan and you develop dry mouth with dizziness, nausea, vomiting, diarrhea, weakness, or dark urine, take that combination seriously, especially if you have been sweating a lot, eating poorly, or recovering from illness. Many people assume they should simply push through a few bad days, but blood pressure medication plus dehydration can become a dangerous combination quickly. If you feel faint, lie down, rise slowly, rehydrate if you are able, and contact your healthcare team promptly, especially if symptoms are continuing. This matters even more if you are older, smaller in body size, already prone to falls, or taking other medications that lower blood pressure. A morning fall often looks sudden from the outside. Inside the body, it usually had a buildup. Dry mouth, imbalance, fluid loss, poor intake, dizziness. The body gave warnings, but nobody recognized them as a sequence until gravity did. Now I want to give you the symptom map I wish more patients had on their refrigerator. If you wake with dry mouth and you also have a persistent dry cough, especially at night, think lisinopril conversation. If you wake with dry mouth and by evening your ankles or lower legs are swelling, think amlodipine conversation. If you wake with dry mouth and standing up makes you feel unsteady, especially after illness or heat, think losartan or valsartan conversation, though lisinopril can do that too. If your mouth or throat feels strange and you notice swelling of the lips, face, or tongue, think emergency, not convenience. If headaches, pounding heartbeat, flushing, or afternoon fatigue are coming along for the ride, the pattern matters even more. This map is not a diagnosis. It is a way to listen. Because symptoms make more sense when grouped, and once grouped, they become much harder to dismiss. There is one more reason dry mouth deserves respect, and it has to do with sleep. Many viewers who wake dry are also waking tired, and that is not an accident. A nighttime cough from lisinopril can break your sleep in fragments. Mouth breathing can dry the throat and make sleep less restorative. Getting up repeatedly for water can keep you in a cycle of shallow rest. Dizziness or a sense of internal shakiness can increase anxiety about falling, which then makes sleep even more fragile. So when people say, "It's only my mouth," they are missing the system-wide cost. Poor sleep worsens blood pressure control, balance, mood, memory, appetite, pain tolerance, and daytime energy. The body is one conversation, not a stack of unrelated parts. The mouth, the throat, the circulation, the kidneys, the brain, the sleep cycle, they all speak to each other. Dry mouth may be where the conversation becomes audible, but it almost never ends there if the pattern keeps repeating. If this video helped you connect symptoms you had been treating as unrelated, share it with someone who takes blood pressure medication and keeps saying they are fine, even though they are clearly not feeling fine. And if you are that person, let this be the day you stop minimizing what your body has been trying to say. You are not being dramatic for noticing patterns. You are being wise. Your mouth, your throat, your legs, your balance, your sleep, your energy, they are all sending information. Listen earlier. Speak up sooner. Never change medication on your own, but never stay silent about side effects either. Your help is not just about lowering a number. It is about living safely and comfortably inside the body you have. Take care of yourself. Pay attention to what keeps repeating, and I'll see you in the next video.